Welcome, everyone, to today's lecture on common medications and important considerations. We will cover a range of topics related to medication administration and factors to keep in mind when prescribing or managing various medications. Let's get started. Acute chest pain. When it comes to managing acute chest pain, it's crucial to provide swift relief. The medication commonly administered for acute pain is nitroglycerin. Nitroglycerin is a potent vasodilator that helps relax and widen blood vessels, improving blood flow to the heart. Administration guidelines. Time between administration. Nitroglycerin can be administered every 5 minutes, up to 3 doses, to alleviate chest pain. If pain persists, medical attention should be sought immediately. Maximum dosage. The maximum recommended dosage generally depends on the formulation and strength of the nitroglycerin. It's crucial to follow the specific instructions provided by the healthcare professional. Warfarin. Warfarin is an anticoagulant that helps prevent blood clots. However, there are important considerations and contraindications associated with its use. Contraindications. Warfarin should be avoided in patients with active bleeding, bleeding disorders, or a history of heparin-induced thrombocytopenia. Pregnancy is also a contraindication, as warfarin can harm the fetus. Nursing considerations. Regular monitoring of the International Normalized Ratio, INR, is essential to ensure the appropriate dosage of warfarin. Educating patients about potential interactions with other medications and the importance of consistent dietary vitamin K intake is crucial for optimal therapy. Tylenol. Tylenol, or acetaminophen, is a commonly used analgesic and antipyretic medication. Mechanism of action. Acetaminophen works by inhibiting the production of prostaglandins in the central nervous system, which helps reduce pain and fever. Administration with NSAIDs. When taking Tylenol, caution should be exercised when concurrently using nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or aspirin, as they may increase the risk of adverse effects, particularly on the gastrointestinal system. Toxicities. Excessive or prolonged use of Tylenol can lead to liver toxicity. It's important to adhere to recommended dosages and avoid alcohol consumption while taking this medication. Aspirin. Aspirin, also known as acetylsalicylic acid, is a widely used medication with various benefits and contraindications. Mechanism of action. Aspirin inhibits the production of prostaglandins and thromboxanes, which are involved in inflammation, pain, and platelet aggregation. Contraindications. Individuals with a known allergy to aspirin or a history of gastrointestinal bleeding should avoid its use. Aspirin should also be avoided in children and teenagers recovering from viral infections due to the risk of Reye's syndrome. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, are commonly used for pain relief and reducing inflammation. Mechanism of action. NSAIDs work by inhibiting the production of prostaglandins, which are involved in pain, inflammation, and fever. Contraindications. NSAIDs should be used with caution in individuals with a history of gastrointestinal ulcers, bleeding disorders, and renal impairment. It's important to consider potential drug-drug interactions, particularly with anticoagulants and certain blood pressure medications. Antibiotic administration. Antibiotics play a vital role in treating bacterial infections, but proper administration and considerations are essential. Penicillin and cephalosporin considerations. Drug-drug interactions. Some antibiotics, including penicillins and cephalosporins, may interact with medications such as oral contraceptives, reducing their efficacy. It's crucial to consider alternative contraceptive methods during antibiotic therapy. Considerations when initiating antibiotics. Proper identification of the infecting organism, appropriate dosage, and adherence to the prescribed duration of therapy are of utmost importance to ensure effective treatment. 3. Other adverse effects. Antibiotics can sometimes cause gastrointestinal disturbances, allergic reactions, and contribute to the development of antibiotic resistance. Types of superinfections. Superinfections are secondary infections that occur due to the disruption of normal flora during antibiotic therapy. Beta blockers. Beta blockers are medications commonly used to treat cardiovascular conditions, but there are important considerations to keep in mind. Contraindications. 1. Beta blockers should be used cautiously in individuals with severe asthma, chronic obstructive pulmonary disease, COPD, or heart block. Mechanism of action. 1. Beta blockers work by blocking the effects of adrenaline, resulting in decreased heart rate, reduced blood pressure, and cardiac workload. What to check before administering. 1. Before administering beta blockers, it's important to check the patient's blood pressure, heart rate, and assess for any contraindications or potential drug interactions. Considerations for patients with heart failure. In heart failure patients, beta blockers can improve cardiac function and reduce symptoms. However, careful monitoring is necessary to avoid exacerbating heart failure symptoms initially. Potassium-sparing diuretics. Potassium-sparing diuretics are commonly used to manage fluid retention, but nursing considerations and potential complications should be noted. Nursing considerations. Regular monitoring of electrolyte levels, particularly potassium, is important to prevent hypokalemia or hyperkalemia. Educating patients about dietary potassium intake and the importance of medication adherence is crucial to maintain electrolyte balance. Complications. Potential complications of potassium-sparing diuretics include hyperkalemia, metabolic acidosis, and endocrine disturbances. Mechanism of action. Potassium-sparing diuretics work by inhibiting sodium reabsorption in the kidneys, promoting diuresis while retaining potassium. Phenazopyridine. Phenazopyridine is a medication used to relieve urinary tract discomfort, but it's important to consider certain factors before use. Mechanism of action. Phenazopyridine acts as a local analgesic on the urinary tract, providing relief from pain, burning, and urgency associated with urinary tract infections or irritation. Contraindications. Phenazopyridine should be avoided in individuals with renal impairment, liver disease, or a known allergy to the medication. Tetracycline. Tetracycline is an antibiotic with a broad spectrum of activity, but there are important considerations to keep in mind. Mechanism of action. Tetracycline inhibits bacterial protein synthesis, preventing the growth and replication of susceptible bacteria. Contraindications. Tetracycline should be avoided in pregnant women and children under the age of 8, as it can cause permanent discoloration of developing teeth and affect bone growth. That concludes our lecture on common medications and important considerations. Remember, it's crucial to understand the mechanisms of action, contraindications, and nursing considerations for each medication to ensure safe and effective administration. Thank you for joining us today, and we hope you found this information valuable. If you have any further questions or would like to suggest topics for future lectures, please feel free to leave them in the comments section below. Stay curious, stay informed, and until next time, take care.